Hello, everyone. We're going to go ahead and get started. Welcome to the library today, and welcome to those of you who are watching online as well. I want to take a moment to give a shout out about a few other events that are coming up at the library. Tonight, there is a talk with Dr. Adriana Stacy about the book The Anxious Generation by John Haidt, and the library's annual literary festival, True Lit, goes on from October 12th through the 19th with a variety of author talks, writing workshops, and featuring an evening with author Nick Stone. So there's always a lot going on at the library. This afternoon, we are delighted to welcome Rain Bowie as part of the library's What the Health series. Rain will talk to us about organizing our medical history by using a body resume to ensure that we have accurate health information to share with medical providers. This clear and concise record can save time and stress by simplifying our medical appointments. Rain, thank you for being here today.
Thank you so much. I'm very happy to be here and share this wonderful idea. I just want to get started and ask, how many of you find doctor visits to just be stressful? Everyone. Oh, is there anything particular that's stressful about it for you?
For every medicine I'm taking or every supplement I'm taking.
Yeah, and those can add up quick as well. I had that same experience. You think you're just taking a couple of things, and the next thing you know, it's hard to keep up with. Maybe you had to change, milligram dosage goes up and down. That is hard to remember and keep up with. Well, I do have to say you are in the right place to get help with that and many other things. My name is Rain, and I'm here to tell you the best idea that you probably haven't heard about yet, and that is the body resume. This is a document that is not only customizable to your unique needs, it can also save you tons of time, reduce lots of stress, and it can even help your doctors provide better care by giving them a fuller picture of your health. By the end of this, you'll see how the body resume can make your healthcare experience not only more efficient, but also less overwhelming and much more manageable no matter what your health situation is or what you're dealing with. We'll go over what exactly it is, walk you through some examples of what you could provide on your own document, and then we'll also wrap up with a Q&A near the end. So first, let me just take you to my own medical frustrations and anxieties, which actually led me to the discovery of this. I grew up actually with many different health problems. It was very overwhelming. Of course, as a kid, I had help from my family and parents with that, but even then, I still had rotating prescriptions, unpredictable complications, new doctors, and then even as I got older, that was made worse with frequently moving. So this was already an overwhelming process just for managing my medical information. I was constantly playing catch up with new doctors, bringing them up to speed on my extensive medical history, which makes a very draining process even harder. By late 2021, I actually moved here to Arkansas due to some COVID-related issues that I went through. And I found myself once again with a new aspect of health problems that I was going through. Some of them I had struggled with my whole life. Some of them were also very, very new. But I was still in a new place with new doctors, again playing catch up with everything that I had been through. Everything was so complicated, and I was all on my own doing this, that I was in the middle of my own storm of health issues. It was very overwhelming, frustrating, and draining. Ooh. Sorry about that. And it became a full-time job managing my health. It was very difficult to keep up with everything. And one day, with the same frustrating process, I just kind of threw my hands in the air and I was like, why can't I just send them, a resume of everything that I've been through? So that way, like a job, since this feels like a job already, there we go. And then it dawned on me, maybe I really could do that. So I did a little bit of web search. There was not a whole lot out there. If you put in health resume, you get information to how to be a healthcare provider, which didn't really help me until finally I landed on the term body resume. There were a few resources out there, but honestly not very many, but it was just enough for me to get started. So that's exactly what I did. I customized my own version and I started taking it to doctor's appointments, and then literally everything changed. I was dealing with less paperwork. My appointments were streamlined and more efficient. It seemed like the interactions between doctors and staff were just easier across the board, and overall my stress melted away. And then by mid-2023, I had actually achieved all of my major health goals. Some of these I had struggled with my entire life, and in just a mere 2 years, I was able to get everything accomplished. That's how efficient this was. Unfortunately, I was told at times that some of this stuff I may never fix, I may never get help for, I may never, overcome some of it, but yet here I'm standing in front of you today with literally some of the best health. No, it is the best health I've ever had in my entire life, which has inspired me to be here today. So whether you have a complicated health history like mine or not, literally anyone can benefit no matter what your circumstances are. There is a phrase that health is a crown that only the sick can see, which is a phrase that means we often take for granted our health until it's gone. And unfortunately, sickness, illness, or even an accident can take us by surprise. It can hit us at any day. So I am confident that this tool can transform your life just like it's transformed mine. So what is a body resume? Simply put, it's a document that you can put all of your medical information on that is designed to share with healthcare providers. Think like a job resume, but it's for your health history instead of your work experience. It breaks down your information into easy-to-read categories, so that way you can quickly see important details. The best part is you can be completely customizable with it. You control the level of detail that you want to add, and there's also no right or wrong way to make one. It works for anyone, no matter your history. So let me explain why this is so helpful. Well, first of all, it is very easy to update. Whether you have new meds, recent test results, a new doctor, you can just modify that document in mere minutes once it's built. There's no remembering every little detail, especially when you're stressed or overwhelmed. It can reduce your anxiety during doctor visits because you don't have to recall your medical history or your prescriptions that you have to go through on the spot. I mean, we've all been there before, struggled with specifics of filling out a form or telling a doctor because life can be too hectic. Maybe if you're like me, you're at an 8 a.m. appointment and you don't like getting up early, then maybe that's also a struggle. But with that, again, that can just make all that stress melt away because with the body resume, it's just all there and ready for you. It's not just about these little conveniences, though. It can also be very, very important for accessibility. Whether you deal with issues like arthritis, vision problems, or speech issues, this removes the need to fill out forms or give certain specifics repeatedly, which itself can be very draining, especially if you're going from doctor to doctor. This can also help you as well as anyone that is assisting you or that you might be assisting as well with managing healthcare. Another way to think about it is that health is like a puzzle. The doctors are trying to piece together your unique situation with the information that we have on the table. When you have a clear, organized outline, doctors can better get a full picture of your health. And then this way, this ensures that nothing is missed. We have everything on the table to get the best picture put together. Now, you can use this in a variety of places. It's especially helpful for if you're doing initial medical intakes, seeing a new doctor, or even doing a routine checkup. But it's also not limited to just those kinds of medical professionals. You can also use it with other trusted professionals, such as a dietitian, a fitness trainer, or perhaps even your dentist, for comprehensive views of your needs. It is very adaptable, which is part of what makes it so powerful. And honestly, I think literally anyone can benefit from this, especially whether you have trouble remembering parts of your health history, if you are like me and dislike handwriting, or if you just want more efficiency in your medical appointments. But it can be particularly useful if you do have an extensive medical history or see multiple specialists or doctors. But again, even if you have a simple medical history, this will still save you tons of time and stress. There are also a lot more benefits than meet the eye, especially in practice for me. One of the first things I noticed is that it was easier for doctors and staff to read my information. I had always thought my handwriting was clear, printed, easy to read, but it turns out not everyone interprets it the same way. So they were able to take my information and digest it a lot faster, not have to use any clarifying questions by having this all typed up and easy to read. I was also able to give more details in my medical information. Sometimes with those intake forms, they could be cramped. There would be some specific questions they might ask, and there was only a line or two, and I had much more history than what a line or two could fit. So instead of having to cramp all these little details and make it tiny and, again, hard to read for my staff, this made sure that nothing was left out. One unexpected thing that I got from this experience was whenever I brought in my body resume, medical staff actually seemed to take me more seriously. Oftentimes whenever I brought in this document, I would get compliments or praise. Sometimes even the staff would say that they wished more people would do this, or that more patients, not enough of them, did this. So by having this, it does send a very strong message to your medical staff of all levels. It shows that you're organized, at least with what you have, it's all present, that you truly care about yourself, your health, and that you're actively involved in managing it, which shows a lot of power to these medical staff in show. Now, I never exactly felt mistreated, of course, in medical experiences, but this certainly gave an extra level of respect or treatment, or at least a big impression that I made on them that made me feel really good about having it. Another thing that was really surprising, I thought this was help a little bit, but not nearly as much as I experienced, is that it saves so much time, not just with paperwork, but just in general. Again, I expected it to help me with my memory or those forms, but essentially here's what happens. You fill out your form and then you hand it to the staff, right? And then the staff, they put that in their system and then they compile it up for your profile for the doctor to look at. The doctor looks at that all, comes to see you, and then there's still more questions from the doctor to get to the real root of your issue, to come up with a game plan or an action plan for whatever your goals or problems are. And then with that, maybe there are some other tests that need to be made, or referrals. Either way, that's going to be some more back and forth between the doctor, the staff, and you. And now, just describing that is already a long time, let alone if you had any follow-up appointments or anything that complicated might have come up in that appointment. So with the doctor already prepped, having all of that, we could dive straight into an action plan, and those back and forth steps were shortened or just skipped literally entirely. So this often cut my appointment time down very dramatically, at times literally to half or less of what I had experienced in my past. It's truly eye-opening to experience this. It really affirmed that I wished I had known about this sooner in my life. So now we've covered a lot of the benefits that you can get from a body resume, and now we can dive into creating our own. I will go over some key details and some specific examples for these details that you can add on your own body resume. I do just want to say only include what you're comfortable with sharing. Just because I suggested it here does not mean that you have to follow this precisely. Again, it's customizable to what your needs are. These are merely suggestions. Again, also you can customize multiple versions if you need. So you want to have a one-size-fits-all, but maybe you want something a little bit different for a fitness trainer and dietitian, or for a specialist. You don't have to just have one. You can have one that suits your multiple needs, because we're all complex, dynamic beings. So, as we're getting started, you are going to need to consider a few things. The first of them being you are going to need a computer to create and edit your documents. If you don't have access to that, we do have places like the public library, or here at the Fayetteville Public Library, where you can write that up on your own, and you can even get assistance for printing it. But if all you're looking for is a printer, because you do want to have a hard copy handy, then there are also print shops outside of the library, such as Office Max or Depot, even Walgreens. Retailers like these can help you with simply just printing your document that you need. Also, be considerate of your audience that you'll be sharing this with. Are you going to be sharing this primarily with your family doctor? Are you going to a specialist? By considering who's going to be reading that can help you understand and figure out which details that you will want to include on your body resume. And again, you can make different versions if you would like to. Also, make sure it is readable. Easy to read fonts like sans serif fonts like Arial or Calibri would be best. They are most easy to read. And a font size between 10 to 14 points is the standard for people to be able to read print comfortably. Also, understand your privacy and security of it. So don't add especially sensitive information that could pose any risks to you. For example, say you want to have an emergency copy in your purse or wallet, or even in the glove box of your car, say an accident happens. If you're going to have something like that, then definitely limit it to your health essentials, which means no social security number, no home address, and no job or employment information. These are all things that, again, if it gets in the wrong hands, you just want to keep it pertinent to what a medical professional can dissect from. So once you get started, it is easiest to begin building on your basic details. These are things that pretty much every medical form is going to ask you. There's going to be things like your name. You can separate your preferred and legal if they are different. Your sex, which you can also include your gender identity or pronouns if needed, or again, if they're different. Your date of birth, as well as your current contact information, such as your email or a phone number. Disabilities that you experience either in day-to-day life or accommodations that you may need for the appointment itself. These are all things that are good to keep up at the top, so that way the medical staff can be most mindful of your needs. Another thing to add is your emergency contacts. Again, we don't want to have any sensitive information about our address or job information, so don't do that for your emergency contacts. Again, just limit that to something like a phone number or email. One thing that I added in the body resume is actually an objective or goal point. I think by adding this near the top, it has been very helpful for doctors to hone in on your focus or whatever plan of action that you have for your health. And then that way they can help build a game plan and prioritize properly for achieving your goals. And it can also help them give more relevant information of what you're actually looking for. So that is something, again, that I added that wasn't suggested. It helped a lot with streamlining that process. Then you'll want to add more details with your current medical information, which can include your current or most recent doctors. So be sure to include their name, contact information, what they treated you with, as well as the time period which you saw them or consulted with them. This is helpful because New staff can get your former medical documents if needed and streamline that process. That's happened to me a lot with going between different doctors and specialists, and believe me, waiting on that paperwork to come in can sometimes take a lot longer than we want to, especially when we're anxious about our own health. Another thing is to be sure to include your intakes, which is prescription medications as well as any over-the-counter supplements. This can be very good for doctors to see if there are going to be potentially any interactions between the supplements and medications you're taking, or if there be any potential interactions between something that they want to prescribe you. That is something to help avoid. They can help you figure out a game plan for what's going to fit you best. Another good thing to add are your immunization history. This is something that can be helpful for doctors because it can help them see any vulnerabilities or risks that you might have. Some vaccines actually wear off sooner than their recommended time to get it, so it's a good thing to track. For example, I do have a friend who works as a plumber, and he has to get his tetanus shot pretty regularly. He actually discovered that he can't wait the full 10 years to get his tetanus vaccine. He actually has to get it every 4 to 5 years because his body is different and unique and goes through those antibodies at a different rate than the recommended. So this is just generally a good thing to kind of keep up with, and if they see anything on your blood work, they can again kind of help you figure out what you want to stay protected against. So now we can start painting more of a picture of details that give a fuller picture of what we've gone through in our health experiences, and these are our medical experiences. So generally you're going to include things like your recent or most impactful experiences, such as your recent screenings or test results. It can be anything from a routine swab or blood work. I will say this is something that helped me dramatically. I actually took the results of my annual routine checkup and I took it to a specialist. Didn't know if she was going to need it, but I was like, I'm going to keep this on hand because this is a very tricky situation we're in. And it actually turns out 4 of the 5 or 6 tests that she needed was already present on that recent blood work, which, as we all know, insurance can be very fun. Because I got it with my annual coverage, it was actually considered preventative care. So it was completely covered, those labs. If I had to get those done a second time, that could have been hundreds of thousands of dollars that I would have had to pay that wouldn't necessarily have been covered with my insurance, because while we're not covering how insurance is coded, this is also something that you can benefit from. So because I had my little folder with my resume and then my blood results in the back, I was able to avoid not only getting more pokes and jabs and blood draws, but I was able to save a lot of money as well. So big help with doing things like that. Also note major illnesses, especially ones that were in your childhood or might have been particularly effective on you. These can be things like chickenpox as a child, perhaps a long run of bronchitis, or even really severe reactions to having COVID. These are important because as research comes out, doctors and researchers can connect dots of things we might not have formally known before. For example, such as a correlation between getting shingles as you're older and the correlation of you having possibly chickenpox as a child. That's just one example. There are many things that we can't even really ponder about what it could help with, but things that really threw you for a loop health-wise, these are good things to keep in mind. Also add your known allergies, whether it's things like seasonal, pets, latex, food, medicines, or otherwise. These are very important here because this can, of course, keep the doctor from exposing you to any of these allergens, especially if it is a medication. But they can also see if there might be any adverse reactions from a medication they might want to give you, or perhaps even something that you're taking that you didn't know might be causing a reaction. For example, milk thistle is a supplement that is touted for giving liver support and liver health. However, if you have a ragweed allergy, you're not going to be getting any of those benefits because it's actually in the same family as ragweed. So if that is something that is a concern of yours, definitely talk to your doctor about that and see if there are any alternatives. Again, that's just one example. This is also a good place where you can include your mental health. If you have struggled with any conditions or diagnoses such as anxiety or depression, as well as any current therapies you might be involved in, are just good to add here. All right, and so then we go over to our day-to-day habits. And I will say, if you add these specifics, honesty is very crucial with this. Again, only add what you're comfortable with, but with adding these, safety procedures such as the use of a helmet or seat belts, whether you own or use a gun, or different hazards you might be exposed to, such as smoke or gas in the home or at work. Also, if you have considerations of using a smoke detector anywhere in your life or carbon monoxide detectors, these are also helpful to include. Also, our lifestyle, from our diet to our exercise, whether we smoke or drink, or our sexuality as well as relationship status, these are all things that can really impact all of our situation. This is definitely something, again, you want to be honest about because it can give a great insight to what we're experiencing. For example, my stepfather, he battled high cholesterol his whole life. Took different meds. It was costly in his time and money, and he often had side effects, but this was something he really needed to get taken care of. This was not just a simple high cholesterol. This was in the 800s. So this is something that he wanted to take seriously, but he struggled with being honest with his doctor about certain lifestyle habits. He did tell them, I have a very physically intensive job, so I am getting a lot of exercise, and I do my best to eat well. But he definitely omitted that his primary diet was a lot of pizzas, burgers, ramen noodles, and a severe lack of cardio and vegetables. So after about 5 years or so, all this money and time gone in and a lot of frustration, he finally threw his own hands up and he became very, very honest with his doctor. He did have to change his lifestyle a bit, and then the meds started to make an effect. However, because of that, they actually discovered a genetic component within him that actually affected that a lot more than his diet and exercise, which he wouldn't have known about because he was adopted. So even though it wasn't entirely about his lifestyle, by eliminating that, we could still see what other contributing factors were really present, and then he could actually get the actual medication and help that he needed and even deserved to get through. So again, I will say that honesty is very important with this. I would say that our habits do impact our health in small as well as major ways, and our first step to improvement is just being truthful. Yeah, I don't know what that is either. Oh. Having some technical difficulties. That's the carbon monoxide alarm, and we're all just we just covered that. All right, well, as long as we're okay, yeah, we continue that. I'm used to my cat yelling at me all the time, so. So, after our day-to-day habits, then you can start delving more into specifics that you've been through. So this would be things like surgeries or accidents. As far as surgical procedures, you can include anything from just minor biopsies to literal brain surgery. Especially note issues you might have had, such as delayed healing, adverse reactions, or other complications that might have helped or might have happened during that situation. Also, accidents, from major car accidents, broken bones, and even sports injuries. These are all good to include, but even minor injuries can come back to haunt us later, even if we think they're not a big deal. For me, I had a very minor car wreck, just a little bit of whiplash, and then 2 years later, and for the rest of my life, it decided to be a bother because I thought it would never come back. I thought I dealt with it fine, but these are all small things that could come back to impact us at a surprise. I had no idea what it was until I talked with my doctor what was going on. So be sure to include dates of when this happened or a time range, such as if you were playing football in college or high school or maybe doing roller derby. These are all good things to include. Again, kind of a date range of your exposures there. So, moving on, we are going to want to try to collect as much information as we can from our close family members, things like their perhaps habits, but especially their illnesses, diagnoses, even mental health medications and allergies. Hello. And this is especially helpful whenever you get it from both of your parents or both sets of your grandparents. But it doesn't have to just be limited to those. You can also include information from other close families, such as siblings, half-siblings, even close aunts and uncles. All of this can help paint a picture for genetic risks and exposures. This can also be something that you can mention if you are adopted or if this is just hard to talk about. You can also note if this information, for whatever reason, is inaccessible to you. Again, that can just help doctors know what they're working with. All right, and then we can get into more specifics after that. Sex-specific, especially for females, it is helpful. Oftentimes you'll probably get asked about when you first started menstruating, and even including the regularity of your periods can be very, very helpful. Also, pregnancy experience from your history of pregnancies, also including miscarriages, successful births, or any complications or issues you might have had during are very, very important to include here. Also, your history of using birth control, hormone replacement therapies. Be sure to specify the methods, durations in which you used it, and any reasons for starting or stopping this medication. Also, gynecological health. These can be anything from issues, recent exams, results of tests, relevant surgeries, or any major changes that you've gone through recently or throughout. As far as males, while they do share a different experience, there still are some things that they need to take very seriously, and that can include sharing results of a PSA or prostate-specific antigen in their blood work, or dates and results of their last prostate exams, especially for men who are over 50. You can also include reproductive health experiences, which can be anything related to pain, exams, surgeries, or also significant changes that you might have undergone throughout your life or recently. Now, while the body resume is extremely powerful, it's still not the entire battle. You really need to have effective communication with the staff of all levels. Basically, you do want to make sure and remember that you have the power to request documents or the records, whether it's the notes of just a, regular doctor visit, your test results, or reasons for stopping or starting meds, or for giving or not giving a specific test. Those are only just examples of what all you can ask for in receiving your medical records. It can be very, very beneficial to keep your own copies for your reference, which can prevent repeating tests or delays, like I mentioned with keeping my own blood work for my other doctors. Also, again, honesty truly matters. I would say only include truthful information in your document. Again, you don't have to include everything that I have here as a suggestion, but whatever you do add, again, make sure it's honest. I would go so far to say that including nothing towards it in your document is better than providing the wrong information. Also, try your best to be honest in your consultation as well. We all have things we might be embarrassed about, like, or maybe just don't feel are super significant, like with my stepfather and his cholesterol and lifestyle. But these are things that ultimately help our doctor help us. Their job is really to help us no matter what it is. Believe me, I worked in student loans, and I would know that they definitely care a lot more about helping people than pretty much any other argument that I have heard to deal with that. Also, with that, doctors are also only human as well. Just like us, they can have really long days, get stressed out, they can get sick. They are doing their best, but at the end of the day, they're still not perfect. They're still human. And also, while they're doing their best, they're also not mind readers, which goes back to the point about our effective and direct communication is very helpful. So again, being honest and clear in your communications combined with a body resume can ensure the highest rates of success for you. So I know this might sound like a lot to take in, but you don't have to do it all at once. You can just start with your basic information and then just build up from there, bits at a time, just slowly hack away at the pieces or add as you see fit. Again, it is easy to update, so you can share with any doctor at any time. Again, be sure to keep a hard copy on you, either a copy directly on your phone or in an easy to access spot where you can find it. It truly reduces a lot of stress to have that thing handy. So now that we have gone over what a body resume is, why it's useful, and how you can get started on your own, I just want to open the floor to any questions that we might have about this or related.
Question. I have filled out their paper form ahead, sent it, or I sat in their office and filled out their little laptop thing, or talked to the nurse, and then the doctor comes in and asks them like she hasn't even read it, or he hasn't even read it. It feels like there's even sometimes their questionnaires have redundancy on it. So I'm wondering if you give them your resume, do they enter it in, or are they still going to talk to you about all of it? It feels like there's just, I don't know, even though I told the nurse the doctor wants to ask it all to me. And I recently just thought, this is really weird that
It's repetitive,
Yes.
It's redundant, it's draining. Yes, I experienced all of that myself. For the most part, aside from a doctor here and there, whenever I hand them the body resume, they take over. They put it all in the system themselves because they're going to take whatever I'm using, generally whether it's an iPad or a paper form. Paper form's the most that I've used, usually goes straight into it. However, they've also usually just slipped my resume right into the doctor's file along with everything else that they've done. My doctor usually looks at that first. I think that's more of a organization to organization, like a business to business, like how they organize their stuff. They're always trying to do different ways to make it more efficient, and I definitely understand your frustration there because that was part of why I started doing this. Like, why is the doctor asking me this and asking all these questions when I feel like I've already said this 2 or 3 times to 2 or 3 different people? As far as that, I think it really varies on the doctor. I'm sorry you've had to deal with that, but like I said, with my body resume, for the most part, I don't fill anything out. If there's anything that was missing, then they'll usually ask me then. So, does that help your question? Or?
I think it's amazing. I have taken, like my husband passed away, but he had so many doctors at the end that I had a little thing he kept in his wallet on all of his medications. So, and I had several copies. And even though there was no change, they still wanted to talk about everyone. No change, but they still want to talk about it. So, I just wonder if they're used to thinking outside the box, you know. And I'm for sure going to do this. And I think I have a copy of my last form that I was given for a new doctor. And I think I made a copy, so I don't know if that would be sufficient, but it had you know, all my medications, all my family history, all my everything, and I just thought, as long as I've done this, I just made a copy and kept it, because who knows, but I will forget that I had such and such an age. And it's a lot of mental thought to do those things, even just, you know, the supplement, I'm not on that many medications, but the supplements, you know.
Yeah, especially if you want to try to take more initiative. Like I said, whenever I was taking the milk thistle, and I didn't realize it was aggravating my ragweed allergy. But it sounds like you already had some steps towards having some sort of, maybe not a full body resume, but keeping up with the prescriptions, paper. That is very good. You know, you can always limit to something like that as well. But yeah, it sounds like you've already kind of initially done a lot of it yourself.
Really sick with lots of doctors, that's the only way to survive.
Oh.
To, you know, not for me to survive, but to handle the situation is,
Oh,
you know, be prepared.
Yes.
So I love this concept. This is really good. Thank you.
Great, thank you. Well, I really truly hope it helps you. Like I said, because I definitely understand all this time, valuable resource that you might not get back, and you know, who wants to spend that frustrated at the doctor's office, or you know, struggling to remember certain things, because yeah, it's kind of like you know, lint roller, or what is it, Pokemon. You end up catching all these different things, and it's like, well, how do I organize all of this? It can very much be overwhelming.
So if you're a patient with a doctor, a current patient, you can still ask for a copy of your records?
Yes.
See, I've never done that. It's like, it's when, after I left maybe the clinic, you know, for good, and had the records, got the records so I could give to the next clinic. I didn't know you could do it like that.
Yep.
Does anybody ever fuss about that?
Yes. They
Um,
do. Yeah, even if you're going to see another doctor, sometimes you have to make sure they really sent it. So that you really, so you might have to walk in and get it and then walk that to your doctor, because I've ordered them before with the current doctor and never got it.
Yes, it's all part of the law. If they want to charge you, or they want to charge you for a paper, like a printed copy?
For the records, they charge for it. I'm trying to remember which doctor that was.
Like, oh, I didn't know if they were like charging for the resources of printing it, or if they were sending it like as an e-file or in email.
No, I just changed doctors, so my new doctor said, I'll get them all for you. Don't worry about it.
Yeah, that's.
So my daughter recently had a surgery and requested like several months ahead, and the surgeon was in another state, and they kept saying, we haven't received your stuff yet, we haven't received it, but she requested it like months ahead and had to go in, and then they made her go to the medical records that's separate from the hospital and request it. And so I don't think they like to do it, is what I think. You know, it's not, it takes extra work for them. So if they don't do it because they're too busy and you need it to send to like a specialist or a surgeon, make sure that they send it, and if you need to do something to pick it up. Because it was a panic to get that before the surgery, before the appointment for the surgery.
Oh yeah, and that's extra stressful. It's unfortunate, but there's just going to be some administrative staff that is like that. I was waiting for a prescription myself once, and I was like, hey, I've got 3 days left. I put this in 2 weeks ago because it needed prior authorization. I called, and I was like, hey, I'm going to need that code to talk to my insurance. And I was on hold for 30 minutes. I was like, okay, fine, here's the code. I talked to my insurance. She had just put it in. So, you know, there's going to be mishaps like that that are very frustrating. By having this, at least you're showing that, like, hey, I know what I'm doing. You know, I'm not just one of those people who's lost in the shuffle. I'm not so much overwhelmed. Like, I've got my poop in a group, so to speak, and I know what I'm doing. I take this seriously. So again, you know, whenever I had that experience, there was that kind of extra level of respect of doing this. And for me personally, there have been some doctors that didn't want to print it out or give it to me, and that's just something, it is good to know your rights. That's something I can't really fully cover, the depth of our law and what we can request, but I do know that you can request them, and you do deserve them. And I definitely understand those frustrations, and yes, sometimes doctors can't move forward without that, new ones, and I don't necessarily know the full picture of why they have such resistance to it, but I just know there is sometimes.
Well, they send the color pictures of the surgery either, they send it in black and white, and that really didn't help the doctors, so I kind of felt like they don't want people to leave them or something.
Well, I do think I used to experience that a lot when I was younger, but I do feel that over the past 5 or 10 years or so, there is more of a compliance of wanting to work and help, and it's getting more about customer service. Like, they want the patient to, be more confident in their treatments themselves,
This was the spring, so it wasn't a long time ago.
Okay.
It was the summer.
Yeah.
Here.
Yeah, there's a lot of stuff that could be affecting that too. But at least with this, it does show an extra level of, I know what I'm doing, so you can't pull the wool over my eyes.
Your colonoscopy and you're going, why did you give me this,
Well, you can take it to your next doctor. Yeah, here you go. Here's the results, doc. All right. Well, are there any other further questions or comments or anything? All right. Well, thank you so much for all the great questions and commentary. I just want to leave you with one final thought, and that is that time and health are our most valuable resources. These are things, once we've spent them, we may never get them back, especially in today's world. So no one wants to spend time overwhelmed at doctor's appointments or struggling to share their medical history. With the Body Resume, it does let you and help you take control to save time and get the most out of every visit. So if you have any comments or questions or just want to get in touch, please reach out to me if you would like. I would love to hear if you had any suggestions, or if the Body Resume in the future does make a big impact on your life like it has with mine. I would, again, love to hear that feedback. I do strongly encourage to build your own Body Resume, or even share this knowledge with someone who could really benefit with it. It can really make a big difference in someone's health journey. I feel like everyone deserves a system that works for you, not the other way around. So thanks again, and I wish you all the best health in your life. So.